Hello and welcome back to my channel. In this video, I'm going to share my journey in where I have worked over the last 11 years since becoming a qualified health psychologist. So my journey after qualifying began with working in obesity, so working in weight management, also known in the UK as a Tier 3 weight management service. So this means that patients with a body mass index of over 35 or more come to the service for support with weight loss, but also support with their psychological well-being. And this is because weight and mental health and emotional health are all interlinked. And I'll be talking about more of this in my subsequent videos. So stay tuned and subscribe. So my journey in clinical obesity in the NHS really shaped my understanding of how the mind and body are connected when it comes to what we decide to eat, how much we move, how past traumas really impact on, our eating behaviors and our eating habits. And this was something actually I wasn't really aware of until I started working in this service. And I was actually fascinated, but also quite worried about, how is this even possible? And, how am I going to help these patients to actually overcome and change their relationship with food? But actually, over time, through looking at all the pools of research and evidence-based clinical supervision, I had an amazing supervisor, and just doing lots of kind of training courses and reading around the area, I began to join the dots and actually could see how psychology was really relevant here. And especially health psychology with all the kind of behavior change tools, techniques, theories, and the evidence base, pulling all that together and applying it into the service was actually really amazing. So I spent a number of years in this service before moving on to another obesity service. So half a decade or more in being in this field, really, you've got me to think about how can this, extend beyond the NHS? And that's why I set up Evoking Health nearly 3 years ago. And this was to really broaden the service, to really broaden my offering to people outside of the NHS. And that was for two reasons. The first was, waiting times. If obviously those that can afford to go private can certainly do so, then I would love to help them. But the other reason was to prevent this, to really, how could I apply my skills and knowledge to actually stop people from becoming overweight, really helping them shape their lifestyle behaviors, really getting them to think about the choices they make when it comes to food, when it comes to sleep, when it comes to stress, because all of these are interlinked with our weight. The other reason was because I wanted to do things, I guess, my way. So what I mean by that is I wanted to apply my values and my principles of the way I like to work and help people. And having my own private practice was really the only way to do that. And actually, I enjoy it and I get a lot of satisfaction from doing that as well. So weight management, type 2 diabetes have really shaped the kind of, the reasons why I decided to set up Evoking Health. Apart from obesity, I've also worked in the charity sector. In diabetes, I have also worked in the private sector. So I've worked with corporate companies, and that was looking at applying health psychology into a digital platform. And that digital platform was to then help employers help their employees when it comes to their health and well-being. And again, amazing experience. I learned so much about the digital platform. And actually, it's amazing how, now through technology, health psychology is so widely kind of, transferring it more widely is easier than before. And so working with this corporate company, I was able to, provide health coaching services, shape the digital platform, provide clinical supervision to the health coaches, as well as develop sort of various training programs and deliver those as well. Other things I have done is training healthcare professionals in motivational interviewing, and those are healthcare professionals working in chronic health conditions. And again, it's been amazing to be able to shape healthcare professionals' practice, and that, is a core part of health psychology, and that is things like communication, how we speak to patients. How we communicate in general can really shape a relationship, really make or break a relationship. So I absolutely love training healthcare professionals in educating them in areas of, how patients adjust to chronic conditions, what they think about being diagnosed with a chronic condition, but also how they identify themselves as somebody living with a chronic condition as well, because it is a huge change for patients. And patients need information, and often they don't get this. I've heard so many of my patients and clients tell me that, unfortunately, they're diagnosed with a condition, they're prescribed the medication, but they have no information about the condition or actually the psychology of being diagnosed with that condition. And that's where I come in, and where I actually love to merge that gap. And what I find is patients feel so much better, so much more in control. And it's not easy. It takes a lot of time. It can take up to 12 to 15 sessions of therapy. And in those sessions, I have a deep dive into their lives, into their lifespan, really understanding their story. That is the most important thing for me. And then it's tailoring the service to their needs, creating a bespoke service using evidence-based. And that's where health psychology and psychology in general is unique. We have the knowledge, skills and information to do that. And that's what sets us apart from what I call pop psychology. We've spent years in training, in learning different theories and models when it comes to psychology. Being able to apply those to somebody's life and their health is really rewarding. So helping patients to learn the skills around, mind-body connection, thoughts, so their cognitions, their emotions, their behaviour, and how those things are interlinked. And actually what things they can do, like, for example, mindfulness, using mindfulness to really anchor the present moment, and stopping them from feeling so anxious or depressed whilst managing a chronic condition, is a journey in itself. But actually, patients learn. They welcome the support, and they end up thriving, and they end up creating a much rich and meaningful life, which I myself find really, really satisfying. So I will be doing more videos on those specific skills, really talking about evidence-based practice and how to support the healthcare system and patients with creating lasting habits and healthy habits. So if you would like to learn more, please don't forget to subscribe to the channel using the link below, and I look forward to seeing you next time.